Hello, and welcome back to the channel. It's your public health safe space. Now, people, today we are talking about advocacy, and we've been talking about advocacy since the beginning of our videos. It's your public health safe space, and we want to be able to advocate for people. Now, in this process, what we're doing, we're outside, we're going to watch things happen, the natural flow of life. Today, we're just watching at our own tire shop and we're seeing vehicles go by, but we're addressing something that is serious. Now, we focus on advocacy, and I want to explain to those who don't understand what advocacy is, what it does for the public health sector. And we're going to tell a few stories, share a few laughs, but we're really opening up our minds to learning. Now, advocacy gives people a voice, but that voice alone doesn't change the system. So we want to know how advocacy turns itself into real power. The power that lowers costs, expands care, and saves lives. So today, we're not just explaining advocacy, we're proving it with real outcomes. So I'm going to give you explanations that really gives and delves into what advocacy is and how we can use advocacy to improve our lives and improve our health. Now, everybody goes about their day differently. We all have different tasks. Every morning we wake up, we plan, we make plans, but plans change. And so advocacy falls into it. Now, healthcare advocacy is not just telling patients what to do or helping them get to where they need to be. It is a structured process of identifying problems, organizing people, and influencing systems to create change. And that change is important. That change is what we need to ensure that we get better services and better healthcare results. Now, at the individual level, advocacy helps patients navigate care, and that's good. You know, you get up, you go to your doctor, you go to your clinic, wherever you are, whether it's in a big city or it's in a rural town. But at the system level, it exposes patterns. And this is where we look at access, who is underserved, and where systems fail. Now, once those patterns are looked at, they are organized, and advocacy becomes a pathway to power. So we look at the whole pattern, and then we look at the process, and we can use what we need to change in order to create power for change. Now, advocacy in itself evolves in stages, and we're going to look at this. We have that individual experience where I'll go to the doctor. We also have that community experience where it goes from me to my household to my neighborhood. We have that organized movement where we get together as a group. And then we have policy influence. Now, once we get together as a group, we're able to influence policy and change policy. Now, these transitions are very important because healthcare problems are not isolated. They are tied together. And when I say tied together, we mean tied together in terms of income, education, environment. All these things come together. So this is where advocacy becomes community advocacy, and it begins to address health inequality at scale, health inequality within certain communities, what we are seeing, what we are doing, what we are advocating, what changes need to be made. Now, we want to look at this advocacy and this change that needs to be made across populations. And when I say population, we're talking about things like our youth, our working class, and the elderly. For the youth, advocacy leads to early intervention and better long-term outcomes. Within our working class, it improves affordability, access, and job stability. Because we know if you're not healthy, and you can't afford care, then we won't even have the discussion about job stability, because how are you going to get out and work? No, we also have to include our elderly. It supports chronic care, independence, and long-term quality of life across all elderly groups. And advocacy improves the access that we said, ability to access care when we need it, understanding the care that we actually need and how to ask questions. And then with all this together, it impacts and improves health outcomes, what results we get when we get our care. Now, real policy and changing these is driven by data. So we have to move from theory to proof. I can't just give you the information. I've got to show you where the proof is in the pudding. Now, we're going to look at things like mental health. Now, mental health for veterans, where change occurs there is not just policy, but access expansion. Advocacy from veterans have led to expanded access under federal reforms. The outcome there was veterans were gaining more access to community-based mental health care and reduced dependence on overloading the VA system. And everybody knows the VA system at one point was so burdened that people were waiting months for basic appointments. Advocacy led to these changes, policy and expansion in access. Now, the impact was that healthcare lobbying and advocacy groups historically influenced major policies like the Affordable Care Act and Veterans Care Reform, which demonstrated measurable policy impacts when organized effectively. So once we have that community need and we gather together, we have to organize ourselves in order to impact policy changes. Now, we looked at the mental health for veterans. Let's talk about mental health for the general public. When we talk about general public mental health, we always link it with the 988 crisis line. The 988 system transformed crisis response in the US, and that is a fact. Their funding examples were, when we looked at California alone, invested $19 million to sustain that 988 services. That was between 2023 to 2024. $19 million was invested by California. That outcome for that investment, we saw faster access to mental health crisis care. There was reduced burden on emergency rooms, which was very important. And then we had expanded behavioral health infrastructure. The improvement in the emergency rooms led to, yes, it was a dwindling of wait time in the emergency rooms, but we had people who actually sought care and knew that they would get care. Because a lot of times, we know you go to the emergency room and you say to yourself, I'm here sitting 2 hours. No care, no information, nothing has been done. And most times people just end up leaving without accessing the care they needed. So that investment was really good. Now, there was a breakthrough treatment when it came to pediatric cancer care, and that required advocacy and investment. The advocacy there led to increased funding and accelerated approvals for treatments, which was very important for parents because, you know, once your kids get sick, no matter how composed you normally are, no matter the profession you're in, panic sets in because children are unable to express to us exactly what they're feeling. So being able to get the care efficiently and access it effectively was important. We saw that there was advanced therapies like CART, which improved survival rates in previously fatal cases. There was increased collaboration between research institutions and policymakers that advanced money that was spent and treatments that were given. That made everything timely. Now, the impact here was that advocacy helped to push funding pipelines and regulatory flexibility with those key drivers of innovation and pediatric oncology. And these were led through advocacy. So we cannot downplay the importance of knowing how to advocate for ourselves individually as a community and organizing a group, because what we are seeing is that advocacy can change policy and access. Now, for the undocumented, so we went to the mental health portion, we went to pediatrics. Now we're going to talk about a group that many people tend to want to shrug away, or they feel like the undocumented don't get sick and don't need care. This shouldn't be so, because undocumented eventually become documented, and we need these people in the environment to actually become a legal part of the system and to work. And in order to work and to maintain a stability, we have to be healthy. So undocumented healthcare access led to Medicaid expansions. In California, there was advocacy that led to full expansion of the medical system. 1.5 million undocumented individuals therefore gained access to care. The state reached a record low uninsured rate. In California, somewhere under 6%. Now, with health access, the children, in cases of children, we reported excellent health, which increased by 10%. So children were seeing better health care access, regularity and continuity in care and treatment. So we had more parents saying that their children were experiencing excellent or better improved health. And that was an increased number by 10%, which is a big deal when we look at the overall picture. That financial investment was $1.4 billion initially, scaling to $3.4 billion. These are B's, billion, annually at full implementation. So it started at 1.4 billion, scaling to 3.4 with full implementation. And so we're able to see advocacy for children, just regular routine care, for the pediatric cancer treatment, for the elderly, for mental health. This is really good. The outcome showed increased preventative care, and you know I'm an advocate for preventive care. I really believe that we shouldn't wait until we're at that point of no return. We should start with good health, make changes, make adjustments, and end up with better outcomes and better health care. There was reduced emergency only treatment, because a lot of people, the only time they had care was through the emergency system. So with all these funding and all these implications, the outcome was that we increased preventive care, we had a reduction in emergency treatments, and there was improvement in overall population health. Now, we consider all these, but we cannot leave out home-based chronic care for the aging, those people who age in place. They do not go to retirement homes or community living. They stay at home. Advocacy there expanded home care health through Medicaid-based programs, which saw a lot of lobbying, a lot of funding, and so there was improvement there. Over 350,000 individuals got enrolled in enhanced care programs. The enrollment therefore increased by 61% in just a single year. Some services already were proven cost effective, reducing long-term health care costs. So I know America is filled with different races, different cultures, and many cultures, say someone moving from the Caribbean or from Africa, we are used to taking care of our elderly at home. And the system here realized that cultural impact made all the difference in our stability and our economic function. And so providing a resource, a financial resource, a subsidized resource, a government-backed resource for those families who wanted to care for their aging at home, but still were able to not do it themselves, but hire someone to come in to assist while they became a productive part of society, was helpful and useful. As we said, the enrollment increased by 61% in just 1 year. We saw 296,000 or more individuals receiving community-based services, with over 754,000 services delivered. Isn't that wonderful? So when we lobby, when we advocate individually as a community and then into a group, organized group, this is the result. We see reduced hospitalizations, lower long-term costs, and increased independence, and that is good. Now, I know I've mentioned lobbying, and some people say, but what is lobbying versus advocacy? Let's make the critical distinction. Advocacy builds awareness and mobilizes people, while lobbying directly influences laws. So when we advocate within the community, we want to mobilize a group of people, bring them together because we want them to organize and make changes. But lobbying itself, when these people come together as one unit, they can lobby their members of parliament, they can lobby their community leaders to influence direct change in laws. Advocacy creates the movement. Lobbying turns it into policy. And that's important. And I hope you understand what we're saying. Without lobbying, advocacy stops at awareness. So we could get the people together, we could give them the information and they become aware. But if there's no lobbying, that's where advocacy stops, just making them aware. But when we put lobbying into play, it creates measurable change. And this is what this channel is about. We're dealing with advocates, but we want to come together and be able to make those measurable changes and be able to direct groups and understand that one individual can come together to make a powerful change. As long as we're organized and we come together as a group, we can lobby for change. Now, when we lobby for change, there's that system transformation that occurs. When advocacy is structured and sustained, it transforms. It transforms healthcare delivery, health literacy, which is important no matter where we are, especially in rural communities. It also transforms policy systems and eliminates those bureaucratic barriers because we're able to understand our goals, set goals, and achieve them, which breaks down bureaucratic barriers. It shifts healthcare from just reactive to preventive, from unequal to more equitable. And this is what we want. We want to make sure that no matter where you are socioeconomically, that you can become part of a more equitable system. Advocacy, lobbying, we move from unequal to more equitable. Of course, that creates a socioeconomic impact. Advocacy reduces gap between wealth and healthcare. So healthcare should not just be for the wealthy. And so we advocate and we lobby to ensure equitability. We are looking at expanding access to underserved populations, increasing preventive care, not just going to the emergency room when something is awry. We want to make sure that our daily life involves eating healthy, exercising, keeping up with routine visits, because we want to reduce the long-term systemic costs. Because there is an overburdening cost when most of our care is emergency. When our care is preventive, then we realize over the long term, we are reducing systemic costs. For example, let's look at this. Home-based care programs are already showing cost savings, proving that equitable care can also be economically sustainable. So getting our young ones to the doctor, getting our elderly to the doctor, even us on our day-to-day, we're seeing the men here in the shop, they're working, they're taking care of cars, people are going back and forth. When was the last time they visited their doctor, their provider, their healthcare advocate? It is important that we make time, just like we make time to fix our cars, to get our oil changed, to check the tires, we have to check on our bodies. Our legs, our kidneys, our heart, our brain, the way we breathe, the things we eat, our vision, our dental. We need to check on these things because once we see these programs put into place, we are projecting cost savings and proving that equitable care becomes economically sustainable. So advocacy does start with a voice, like my voice, like your voice. But when it is organized, when it is structured and connected to policy, it becomes powerful. It becomes the change that creates movements. And that's what we need. There is a power that doesn't just improve healthcare at this point. It transforms who has access to care equally, fairly distributed, at a cost that everyone is able to afford. So when you hear people talking that insurance costs are high, even if your insurance cost is not high, there's a burden on everyone because we depend on each other to ensure a stable economy, to ensure that costs remain affordable and as low as possible, from our grocery store to our gas prices, to maintaining our cars, to sending our kids to school. When one part of the economy is burdened, there's a ripple effect on every other section of the economy. Healthcare is where we focus. Healthcare is where we pay our attention. We want to advocate for ourselves because advocacy leads to lobbying, which leads to change, which in the long term shows sustainable and better health choices. Thank you so much for being here. The priority today may be just going to work. It may be getting an oil change, but the long-term goal is overall advocacy and care that improves our lives, give us better futures, give us something to look forward to as we age. Because everyone wants to live to the point where they can look back and say, I've had a good life, I've had a healthy life. And it starts from our youth. Don't wait until it's an emergency setting. Let's make better choices, better decisions. Just like we take care of our cars, let's take care of our bodies. Thank you for being here. Remember, like, comment, share, and subscribe. It's a beautiful day. Get out, make those healthy choices. An apple a day. And remember, go back and watch the 5 movements for a longer life. Thank you so much. Enjoy your day.